Story 33. Wasn't life-threatening, but I fell and got a few stitches in my knee as a teen. The hospital wasn't the best, and I wasn't even fully numb when they stitched me. I was screaming in pain from the needle and sutures, and 2 nurses were holding me down as they finished. However, the first week or 2 I noticed I couldn't walk right. My knee couldn't bend due to the stitches, so didn't think much of it. When they finally came out, I still couldn't bend my knee but figured it was just weak and stiff from being straight for 2 weeks. It still hurt a lot over the following week, and found I was literally dragging my leg behind me as I still could not bend it. My dad was the type, put some dirt in it, son, don't be a baby. And he is the one who took me to the doctor on why I'm dragging my leg like a sack of potatoes. Doctor took one look at it and exclaimed I need to go to the hospital right away. Even threatened that if I didn't go they would have to cut off my leg. TBH, I think she was embellishing, but the scary part not by much. This hospital was really good compared to the one I initially got the stitches at. Turned out I had an infection in the knee that needed several days for antibiotics. They did proper scans of my knee and found I not only blew my patellar tendon, primarily why I couldn't bend my knee, I also mildly fractured the bone itself, which was impressive to do. Story 34. Not a doctor, but my husband suddenly lost 15 pounds over a few days. No changes to diet or exercise. I told him it sounded like diabetes, and please go. He finally went after a week, and by that time he was skin and bones. It was diabetes, and his blood sugar level was dangerously high. The doc said if he had waited 1 more day, he might have gone into a coma. Story 35. Not a doctor, but I had a massive headache, fainting, and extreme light sensitivity. Doctor came and said it was sinusitis. I struggled on. Saw another DR at same practice who confirmed sinusitis. Started slowly recovering, but had extreme vertigo. Got a second opinion, confirmed sinusitis. Went private, was in the UK, and was seen by very dismissive doctor. I insisted on further tests, and he reluctantly ordered an MRI. Turns out I had meningitis. Story 36. Paramedic, not a doctor. A woman called 911 requesting an ambulance. When I and my brand new rookie EMT got there, she complained of just not feeling well and having a mild headache. I did my assessment, and everything looked perfectly normal, except it seemed she might have a cold with a headache. I didn't think she needed to be seen in an ER, and told her so. She wavered back and forth, and then finally agreed to sign a refusal. I sent my rookie partner out to get the clipboard, but he pulled me aside and told me he thought she needed to go. I asked him why, and the best he could do was, I just have a feeling. So I finally relented and told him, fine, you're patient, I'm driving. A few blocks down the road he leaned up front and asked me to make it hot, lights and sirens. I rolled my eyes but did what he asked. At the ED, the grumpy triage nurse came up to me a few minutes later and wanted to know why the hell we transported a perfectly healthy woman with a cold and headache. A cold and headache. I just nodded toward my partner and said, you'll have to ask him. Anyway, we left, but a few hours later we were at the same ED, and that same nurse came up to me and told me the news. Because of the headache, the doc had ordered a CT scan, and lo and behold there was a dissecting aneurysm right next to her brainstem. She had been shipped out to the trauma center by helicopter and was undergoing emergency surgery. I learned later that she survived without deficits. Holy crap. If I'd had a more experienced partner that day, she would have ended up dead, and it would have been my fault. Story 37. Not a doctor. We had to gently tell a co-worker her that she needed a morning shower and/or deodorant. She went to the doctor to get it checked out, and turns out she had a severely prolapsed uterus, and it was infected. We felt terrible telling her she had BO, but thankful she got a very serious situation checked out. Story 38. Went to ER for a headache I'd had for 2 weeks. Doctor wanted to give me allergy meds and send me home. My GP had told me to demand a CT with contrast. Subdural hematoma. Had emergency surgery a few hours later, and spent 8 days in ICU with a drain tube in my skull. Women often aren't taken seriously regarding pain. You are your own best advocate. Story 39. During studying in my practical year. Emergency room, 70-something-year-old woman, lovely person, one of these candy-giving grandmas with perfectly laid curls and all, complaining of a rash. Obviously they sent in the student cause rashes are boring and not really a case for an emergency consult, mostly. So picture me, young and full of excitement about the ability to play doctor in a way. No idea what I'm doing generally, lots of my knowledge gained from Grey's Anatomy, which is definitely not real-life doctor accurate, mostly. I go in there and remember a Gray's case from some long ago episode. I take out my pen and mark the area that is affected by the rash. It's rather small. Right leg, up just slightly above the ankle. Anyways, I just mark it, chatting with the lovely lady. Then proceed to go talk to the real doctor who has finished his studies and gets to do big people medicine. He does not like to concern himself with rashes and such boring stuff, and he also lets me know it. So it takes a few attempts to tell him about that patient. We keep getting interrupted. Obviously everything is more important than some old lattice rash, which is true in an emergency room, mostly. So after I present the case, he dismisses me to go give the woman some cream and get out of here. I still tell him about the Gray's episode where one time one patient had a case of what is called necrotizing fasciitis. Just to let him know that I have marked the area. Necrotizing fasciitis. Cool word, fucked up disease. It's bacteria that move incredibly quick under your skin and est anything in its path, to put it simply, gaining them the name of flesh-eating bacteria. Incredibly rare. He tells me that, laughs it off. I go back to my patient to see that the rash has by now moved up above her knee. All of that within the hour or so it took me to get a hold of my supervisor. Turns out rare things are rare but not unseen, so here I am, patient has necrotizing fasciitis of the leg. Because I marked it, I am sure. So I tell my supervisor, who's with his supervisor at that time. They don't believe me, they go in, they see the marked line, the believe me now. I get to scrub in on her case, we take her leg of close to her hip. It was devastating.